7 a.m. in Halston. London is still in lockdown. But here, social distancing can be difficult. Brent is one of the worst affected areas in the UK. At bus stop X, we meet Marva as she travels to work as a carer.
I'm not really feeling good about it, but I don't have no other else option. People depend on us. They're looking forward to see us in the morning. We still have bills to pay and everything. I have to work.
Most people we speak to are key workers.
I'm going home, just finished shift. I work for the NHS, mental health department, and we've got people in there that we need to look after. Yeah.
I have to work, so I try to feel like it's normal, but it's not normal.
How worried are you?
A little bit, but I try avoid it. I don't think about it. My bus is coming, so it's okay.
Helena leaves to get on the 266 bus to her cleaning job.
It's really hard seeing how many people getting onto a bus because you kind of feel for the driver, you feel for everyone on it, but what are people meant to do if they've got to go to work?
3 miles away in Wimberley, we meet Veronica. She's recovered from Covid-19, but now she's lost her job.
I was freelance, so I was told that, I have just a week's notice. So I've been waiting for my agency, the umbrella, I used to work for under an umbrella company, to kind of know if I can get furloughed by them, but I haven't heard from them. It's been a couple of weeks now.
This is one of the most deprived parts of the country, and now it's got one of the highest death rates. By mid-April, 286 people with Covid-19 had died here.
People are scared. People don't know what has hit us. And the black and the minority community, we are in the front line.
More than 2/3 of people living in Brent are non-white.
It's very distressing when you know that the outcomes are worse for black people and for Asian people, and people understand that, the last time they might see a relative is the time that they're being driven away in an ambulance, and not being able to see them again. It is very distressing. I've lost my uncle to COVID, so it's also sort of very personal, and you just think that a lot more needs to be done. And I think what COVID has done, it really has shone a spotlight in why we really have to address the inequalities in society.
10 miles away, south of the river, things look very different.
So we're right in the centre of Kingston and it's so quiet. I've never seen it like this before.
Kingston is relatively affluent and wages are higher. By mid-April, 54 people had died here, a huge loss, but the lowest number in the whole of London. The death rate in Brent is almost 3 times higher.
Open spaces, people can get out and fresh air, and it's we're not crammed in with lots of high rises and things like that, so perhaps people are a bit more socially distanced normally than in some parts of the capital anyway.
There are so many variables. It's really hard to know anything for certain, but it seems obvious if streets are emptier, there's fewer people getting on buses, more people working from home, then it makes sense that infection rates would be lower in areas like Kingston.
People who live in deprived areas have much shorter life expectancy than people who live in less deprived areas. The lockdown will exaggerate social and economic inequalities, no question. That means it's likely to increase health inequalities.
It's been said that the virus doesn't discriminate, but it may be that Covid-19 highlights the capital's inequalities that have always existed.